Hi everybody! Hey everybody!
Hi everybody.
Hi everybody!
Hi everybody. So, disclaimer on this live video. I'm obviously in the hospital, so when nurse busts in, I may have to put you down for a few seconds.
This is Chanel. She is the 1 in 5 adults who will struggle with medical bills, and the 1 in 4 that have more than 2 chronic health conditions. But those numbers neglect the fact that healthcare will affect absolutely everyone at some point. Unfortunately, sickness is inevitable, and unfortunately, the measure of one's health is not only through illness or pain, but also mental health. Thus, every aspect of our ability to function day to day relies on good health, and as a result, so does the function of our country. And how is the U.S.'s healthcare system doing on maintaining the health of the nation? We are not completely off. There are pockets of innovative and heartfelt care being administered in the nation. Dr. Radona Miller touched on this in an interview.
The renewed focus, not that it always hasn't been this way, but there is a renewed focus on the patient being at the center of all we do. Everything from designing our care models to messaging folks in our electronic medical record, just trying to make care easier to access for our patients, for our customers. That makes me smile.
Chanel even once said that without the recent expansion of coverage under Obamacare, she probably would have been dead a year ago. Lives are being saved. But even with the good, there are still 44,789 deaths in the U.S. per year due to the lack of health insurance, and 145,000 deaths due to medical errors. CNBC reported that nearly 2 million people in 2003 will fall to bankruptcy due to unpaid medical bills. For some, this was even with health insurance. Over 10 million people can't pay, even for necessities, while 15 million drain savings to cover bills. Chanel and her husband Noel are in the midst of the financial turmoil that healthcare inflicts. With Chanel's diagnosis of scleroderma, Noel was financially unable to complete a college degree. Chanel is now unable to work, and extra financial burdens are placed on Noel's back. His wife will be in Chicago for 3 months for a stem cell transplant, and he has to stay home for a majority of that time to work. That's 3 months of terrifying treatment without each other. This is all to say that healthcare doesn't only affect health, and it doesn't only affect the sick. The health of one and their experiences with the healthcare system has a domino effect on their future and the futures of people around them. It's time to find a cure, America. Whether that's through the conservative plan of reducing government influence or the liberals' focus on expanding the system, our solution must come from a deep empathy that recognizes all who are affected, and must be a catalyst for the population of America in developing a healthy system so that we can have healthy citizens.